Denied coverage of your GLP-1? Do not quit. That is exactly what insurance wants you to do. You have rights and you can appeal more than once. Claimable makes it simple with expert-backed appeals that actually have been proven to work. Check out the link getclaimable.com/plus sides and use code plus sides with a Z to save. Hey, Dr. Rudy.
Hey there.
Hey, Dr. Rudy.
Hello there. Hi, everybody.
I don't know how to not call you Dr. Rudy. Is it okay?
I love that name.
Okay, good.
Dr. Rudy, we're so glad to have you here. Welcome to the Plus SideZ podcast.
Yes.
We would love if you would explain to us a little bit about what you do and how you help people.
Definitely. First, I got to say, I just love the energy out here. My God, this is so refreshing.
So glad.
Thank
you.
My passion is nutrition, and I can hear passion everywhere. So that's amazing. So to tell you about me, so I trained, I'm originally from Haiti, came to the US to do my medical practice. I went to University of Florida for my undergrad major, and it was in nutrition, not knowing I was going to go into this, but I always was interested in nutrition. Then I went to University of Miami for my medical degree and started working as what we call a hospitalist, meaning I worked in the hospital. I dealt with ICU care, emergency room, heart attacks, heart failure, acute medicine. And I have to say, I loved what I did. Western medicine is amazing at treating acute conditions, but we're really not that good at prevention or optimization. So I was able to, thank God, me and my wife, who was also a nutrition major, we opened a weight loss clinic called A New You, because I really felt that it's not all about the number on the scale. It is changing the whole vibe.
Yeah.
And that was back in 2005, 18 years ago. And as I went forward into this, I started using, what we had available at this time, like Vicky said, was the stimulant type medication, the phentermine, diethyltryptamine. The Brazilian pills were coming out. So, our tool belt wasn't that great. Then 2014, I started using liraglutide, Saxenda, Doza. Then 2017, Ozempic, breakthrough medication. In 2021, Mounjaro. And then you're like, wow, we're finally getting somewhere now. So that got me excited. And when I take a step back and I look at the trajectory of my career, I actually call myself on the TikTok, Dr. Rudy Best Life. Because I do a lot of things, and a lot of people ask me, "What's your specialty? Why don't you focus on one thing?" And my answer is, my focus is to help you live your best life, but whatever means necessary. Whether we have to use GLP-1, hormone replacement, nutrition, education, behavior counseling,
everything, all that, right? All that.
Not one, it's multifactorial. So, and the advent of GLP-1 medication has really been a true breakthrough in medicine. So I like to say that GLP-1 medications are the most important breakthrough in medicine since the invention of penicillin. That is how much I think about them.
I for sure feel the same way.
I think so. Yeah, I could see that. Absolutely.
And we were talking about, as you said, that's been there forever. So I'm a primary care physician. I've been using GLP-1 medication for diabetes since 2005. So back then, when we were using them for diabetes, there was never all this controversy about it.
Yeah.
When it is for a quote unquote disease, it was just fine and dandy. It's about 2017 when people started using it for weight issues that it became a big problem, a political issue. And then now all of a sudden you hear all those things about the long-term side effects. We've had it for 18 years that we have enough data that to say, of course, are there some possible short-term side effects? Yes, like everything. You got to weigh the pros and the cons, and there's a way to mitigate the side effects. But the overall long-term side effects have been shown to be minor. And actually, every 2 or 3 months, there's a new study that's showing improvement in heart disease, improvement in kidney disease, decreasing risk of Alzheimer's dementia, decreasing inflammation, less risk of cancer. And the list is going on and on and on. So the GLP-1 are a gift that keep on giving.
So true. It's so true. Look, you're an evangelist too.
I know.
I
Rudy's
see.
an evangelist,
Very
y'all.
early adopter.
He was an early adopter. That's right.
Get
Yes.
That's great.
It's,
All right.
there's more coming on the horizon.
I
There's a
know. Very
trickle
Oh,
of
exciting.
yeah, there is.
Yeah.
that's going to come out. So the future of medicine when it comes to this is bright. And to take a step back is what we're
Uh-huh.
seeing, unfortunately, despite us really knowing the ins and outs of nutrition, right?
Mhm.
Rarely do I see a patient come to my clinic and say, I don't know what I should be eating.
Yeah.
Patients will tell me, I know exactly what I should do. I could
Mhm.
write a diet book. I know the theory. I've tried it all. I've read it all. I just can't get myself to do it. And this is when we start talking, is this willpower or is this
Yeah.
really a disease? And that's where I'm so glad that they reclassified obesity as a disease because there's so much that comes into it. Most people who come in my clinic, they are type A personality, amazing people that the one thing that they cannot control is their relationship with food. And then now, as you said, you put them on a medication and all of a sudden you can control it. That says it was a hormonal issue. It was
Yeah.
part of genetic issue that we're able
Mhm.
to change that and now bring the power to the people.
Yes. Love it.
There is no glory in hot flashes.
Hell no. Feels like your damn cells are on fire.
Yeah,
Right?
I don't know why you even want to go through
I
it.
don't even know. Let's talk about it. Let's talk about it. It's the Health and
Mm-mm,
Wellness podcast. We talk about all things that have to do with your body, health and wellness. So,
mhm.
Kat and I both are going through perimenopause. She started going through it first, and then I kind of learned from her. So, we're going to talk a little bit about what her symptoms were, and then we'll talk about what mine are because they're kind
Yeah,
of at different levels of the process. And you can see if maybe that's something you're going through, and we'll tell you what we did. All right. Kat, what was yours like?
we talk about periods now.
We do.
So, warning. So the first sign to me was I'd go 3 months without having one, and then have two in the next month, and it was not fun. It was exhausting. So I went to the doctor, like a good cat, and she said, "Well, surprise, surprise, you're in
Surprise,
perimenopause."
surprise.
You're in perimenopause. I said, okay. All right. So officially, I got my award for perimenopause. No, no, no sooner than I got home, I started having flashes. I said, oh, no, no. Let me go find a telehealth. And Winona was the winner. Winner,
Uh-huh.
winner, chicken
Winter
dinner.
chicken dinner. Yeah, indeed.
Yep.
I know. And then I was like, okay, Kat. And I remember the time like you had started gaining weight and you were like, okay, like, do I need to watch my food? Do I need to exercise more? You like went the whole way, right? Like the whole
Yep.
gamut. And we were like troubleshooting it together because we besties, right?
Mhm.
And then it turned out it was this. Then I started going through it too. I got my gallbladder out. I started having
Mm,
hot flashes. I couldn't sleep for years. And
mm-mm.
I reeled it back in. Couldn't sleep, waking up at 3 a.m., wanting to
They're fun.
unalive everyone everywhere because they were all making me so mad.
Oh, the rage.
I
The rage.
couldn't stand it. Yeah, the rage. And I was like, what is wrong with me? I'm actually very sweet when I'm not yelling at trolls about GLP-1s. And then I was like, okay, something's got to be wrong. So I go and talk with Kat. She tells me she started HRT, the difference it's made. She started losing again. And I was having
Yeah.
very similar, but I still have a cycle. So we were like, we got to learn more about this. So we had on Dr. Kat, who is the chief medical officer for Winona, which is a telehealth that handles all things with perimenopause.
Hmm.
And so we were like, all right, we got to know all about this. We got to know all about this. And we had such a lovely episode. So if you want to learn more about that from a doctor, like go to that episode. But
She's a
if you're having
GLP-1
these
friend.
symptoms, yeah. But if you're having these symptoms, then
Hmm.
definitely look into it. We have a code and a link and all the things to save you money. When you
Yep.
go, we're going to put it in the show notes and in the link tree so that you can go there. But this is definitely something that has helped us considerably. And your body's fluctuating like through this. So you need a good doctor and care and someone you can be like tweak
And
things with
that's the
because
key.
that's what's going on, man. Like
Yep.
there's no need to suffer, right? Like
There's
there's no need
no
to suffer.
glory in hot flashes,
No glory in hot flashes.
nor rage, because
No,
no,
exactly. No. So don't think that just because you have started missing your periods yet that you're not in it. Like go get it checked
it
out
happened before.
and see if it helps you because it has helped us significantly. Right? As Kat would say, it's clutch. So
What?
go to the link
Mhm.
in our bio, go ahead and look into it. We hope that it helps you and we love you.